Hey, 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 it's Deanne here, and today is the fourth video in the Ultimate Digestion Series. And today we're going to be talking about the stomach. Everything you need to know about the stomach, digestion, absorption, and healing. So the stomach sits in the upper abdomen on the left side of the body. It's connected to the esophagus through that lower esophageal sphincter, and it's connected to the small intestine through the pyloric sphincter. Those sphincters are circular muscles that can open and close and prevent or allow food to move down. Okay, we talked a lot about that last week when we were talking about the esophagus and reflux. The stomach's functions, the main functions when the stomach is working beautifully, mechanical digestion. That's churning and mixing of the food. We have that bolus, that ball of food that we've swallowed that's moved down the esophagus. And then when it starts to mix with all the contents of the stomach, it becomes very liquid and we call it chyme. The chemical digestion is that breaking down of the food into smaller particles. So we have secretion of gastric juices, we have breakdown of proteins by pepsin, we have breakdown of fats by lipase, and then we also have protection because the environment in the stomach is super acidic. And that acid kills bacteria that actually can enter our bodies through the food. So it's going to protect us from getting a bacterial infection by killing that bacteria as it moves through the stomach. So, what's inside the stomach? We got lots of good stuff in here. We have hydrochloric acid or stomach acid or HCl. This is secreted by parietal cells, and it's what keeps that environment very acidic, okay, to break down the foods. HCl denatures proteins by causing them to unfold and expose their bonds. And then they're basically broken down into smaller particles that can be used by the body. Kills bacteria. It activates the inactive form, pepsinogen, to pepsin. Pepsin is an enzyme that also breaks down protein. Hydrochloric acid also helps in absorption of minerals and vitamins, vitamin B12, iron, and we'll talk a little bit more about that. And then the immune system. We have immune system cells, we have lymphocytes in the wall that can help destroy damaged or infected cells when they enter the stomach. Mucus cells. Mucus is that whole protective layer. The mucus is this thick protective layer that doesn't allow the acid to reach all the cells in the lining of the stomach because those cells would die. That's when you hear about ulcers, that's when you have irritation of the stomach lining. We also have intrinsic factor. This is super important because it binds with vitamin B12 in the small intestine and allows it to be absorbed. We'll talk a little bit more about that. Gastric lipase is an enzyme that breaks down fatty acids. And then we have bicarbonate that helps neutralize the acid. And I have a photo to show you the acidic part and then the part that's neutralized by the bicarb. So the red section is inside the stomach. So this is where the hydrochloric acid is. This is where the food is getting churned and mixed up and the proteins are being broken down. And that green section is that thick protective mucus layer. And then you can see off to the side, it says pH 2, that's in the red section, and then pH 7 in that green section. And all those long kind of squiggly things, those are cells. And they hold all these epithelial cells, the parietal cells that are secreting all of these beautiful liquids that we need. There's tight junctions in between the cells that don't allow any kind of leakage if acid did get down into that. And if there is any problem with the cells, there is a fast turnover. So we can repair cells that do get damaged. So let's get deeper into vitamin B12. Vitamin B12 is essential for red blood cell formation. And of course, red blood cells carry oxygen to the body. It's important for nerve function as well as DNA synthesis. And that if you don't have enough B12, you're going to have anemia, you're going to have fatigue, you can even have neurological issues. Okay. So what happens is food comes down from the esophagus into the stomach. And then the food, the protein, is broken down into smaller bits and allow the B12 that's in the protein to move away from the protein so it's free. Okay. And so, super important, you have to have HCl in order to break down the protein so the vitamin B12 can actually be free. Then we have intrinsic factor. That is also secreted in the stomach, and that is what is going to bind with the vitamin B12 so it can be absorbed in the small intestine. Iron, something similar with iron. There are two forms of iron: heme iron, which is found in animal sources, and non heme, which is in plant sources. Heme iron is absorbed easier than the non heme, but with HCl, that can make this non heme from the plant sources actually be more absorbable. And that's a great thing for, all of us who are eating lots and lots of veggies. We're able to actually get the iron out of the veggies. Now, iron is critical for hemoglobin, to make hemoglobin, which carries the oxygen. It also supports the immune function, it supports energy. And if you don't have enough iron, you're going to have anemia, you're going to have weakness, you're going to be fatigued, brain fog. Okay. So let's look at some common stomach issues. So, gastritis. When you've gone to the doctor, they may have come back and said you have gastritis. This is an umbrella term that basically means inflammation of the stomach lining. And when we get a little bit deeper, when you get more and more and more of that injury in the stomach lining, it becomes an ulcer. So it's kind of like the degrees that you can have. So the superficial damage is gastritis. That can happen from H. pylori, which is a bacteria. You can also get problems with nonsteroidal anti-inflammatories like Aleve, Motrin, Advil, excessive alcohol consumption, stress, and spicy foods. So again, gastritis is kind of that superficial damage of the stomach lining. Peptic ulcer is just a deeper injury to the stomach lining. Hypochlorhydria, we talked about this last week. This means low stomach acid, low HCl. And again, we know that this is very important because we see how important HCl is to not only break down our protein, but in order to free up both iron and vitamin B12. And we know that hypochlorhydria is the main reason that we have reflux or heartburn. So let's get a little bit deeper into gastritis and ulcers. The way H. pylori works, this bacteria, is it attaches to and then it lives in the wall of the stomach lining. It damages that protective layer, that mucosal layer, and it activates immune cells. And those immune cells, when they're activated, they actually trigger inflammation. You will see that H. pylori you can have H. pylori at a nominal amount and not have problems. But as you get more and more H. pylori, you are going to have damage. You're going to have issues. So Aleve, Motrin, Advil, if you're taking that on a regular basis, those things irritate the lining of the stomach. They weaken the stomach's resistance to acid. Okay, so there's going to be that superficial injury, which we call gastritis. And then when you continue to have that damage, it becomes an ulcer. Alcohol, same thing, damages the mucosal lining, that protective layer that protects those cells from the HCl, from that acid. Now, stress is interesting. So stress basically causes, now we're talking about when you're in stress a lot, when you have chronic stress. So you're in that stress response all day long. And a lot of us are, we just don't even realize it. Because what happens is when you're in the fight or flight response, blood is being diverted away from the digestive system in order to get you ready to fight or flee. It is going to send the majority of the blood to vital organs, to our muscles. And so when you don't have blood coming into the stomach lining, you can actually have problems with those cells. Those cells can start to die in the stomach lining. So we talked about this a lot last week. Hypochlorhydria, that low stomach acid. Why does that happen to people? Well, it can happen with age. You can begin to have less and less hydrochloric acid. With chronic stress, it can decrease stomach acid. Nutrient deficiencies, you need zinc, you need B vitamins in order to make HCl. So if you're low in those two things, you're not going to be able to produce hydrochloric acid. H. pylori, we just talked about that. Medications that you might be on, Prevacid, Pepsid, Nexium, proton pump inhibitors, H2 blockers, they basically lower the stomach acid. So now you can probably see it as very different. We need that stomach acid. It is there for a reason. We do not want to decrease it. Okay. We now know that reflux is not because of high stomach acid. It's because of that lower esophageal sphincter is opening up and loosening, and then things are moving backwards up into the esophagus. Usually you actually have low stomach acid. Hypothyroidism can also cause low hydrochloric acid, excessive alcohol consumption, specific surgeries that we'll look at in a little bit, and then illnesses like diabetes or autoimmune disease. So let's look at ways that you can prevent these stomach issues that we're talking about. One is intentional eating. When you eat, make sure that you're sitting down, that you are relaxed, that you're taking your time. You're smelling and looking at your food so your brain is activated, and then it can send signals to your stomach to start making the hydrochloric acid. Everything works like a symphony. So if you're rushing and you're skipping these steps, then you're just not going to digest your food as well. Chewing is super important. We want to break down the food as much as possible when it's in our mouth, and then it's easy for it to be broken down even more in the stomach. When you overeat, it can be too much for the stomach, and then it's difficult for all of those things to work properly in the stomach and break down the food. Managing stress. Avoiding irritants like alcohol and spicy foods. And again, getting enough zinc. So foods that have zinc, pumpkin seeds, chickpeas, lentils, red meat, seafood, things that have B vitamins, eggs, avocados, beans, lentils, salmon, sunflower seeds. All of these things are great to eat on a regular basis. So you know that you have that zinc and the B vitamins so you can make hydrochloric acid. And then look at some more ways to boost hydrochloric acid. Digestive bitters. When bitters reach our tongue, we have receptors on our tongue that then activate and stimulate our brain. Our brain stimulates the vagus nerve, which then stimulates the stomach to release hydrochloric acid. So bitters taken before a meal can be a great and easy way for you to boost your hydrochloric acid for your meal. Drinking ginger tea, celery juice, lemon water, or apple cider vinegar before meals can do that same thing. You can also use those things during your meal. You can put lemon on your salad and your salad dressing. You can put some of the juice on your veggies. You can marinate your meats with lemon. Same thing with apple cider vinegar. Eating fermented foods like sauerkraut, kimchi, you can just have a tiny little bit during your meal. That will also help boost hydrochloric acid. Again, making sure you get enough zinc and B vitamins. And then if you still are having problems, even though you're doing all these things, you may need to take hydrochloric acid supplementation like betaine. This is very unique. So everybody needs a specific amount for their body. So it's not just a universal dose. So it's something that you have to work on. You take one supplement with your food, see how you feel, you increase, you keep increasing until you have a burning sensation in your chest. Then you know you've taken one too many. So you go down. And that may be the amount that you need for this period of time. However, things can change because your body can get better at stimulating HCl naturally. So you may realize that after 3 weeks of taking 3 hydrochloric acid pills, now you're getting that burning sensation in your chest again. So that means you need to go down to 2. So it needs to be a very customized approach. So let's look at surgeries. Lots of people out there who have problems with weight. They haven't been able to lose weight. They are getting surgeries. And we're going to just talk about 2 today. We're going to talk about the gastric bypass and the sleeve and what problems come up with these things. I've had many clients that have had these surgeries, and it can be really, really difficult because they choose to do these surgeries for weight loss. They don't really understand that there's going to be such a problem with their digestion afterwards. And they think that they're going to come out with no problems at all and just weight loss. And that just usually doesn't happen. Basically, a small pouch is created at the top of the stomach by stapling it off. And then the rest of the stomach is kind of separated, and that little pouch is connected to the small intestine. However, it's not connected to the small intestine where it normally would be. You're actually bypassing a portion of the small intestine. And that's where the problems really come in. So, the surgery decreases the size of the stomach drastically, and that's going to limit the amount of food that you can take in. And it's also going to help curb hunger. You're going to feel full much faster. You're just not going to be able to eat a lot of food. It bypasses the part of the stomach containing most of the parietal cells that make hydrochloric acid. So, that's where problems come in because now you're not digesting your protein as well as you could. It also bypasses the first portion of the small intestine where several things are absorbed, specifically vitamin B12, iron, calcium, and folate. So, everyone who has this surgery is not going to be able to absorb these nutrients from their food and maybe not even from supplements. But these patients are always put on supplementation for the rest of their lives. So you can see before the surgery, this is your esophagus coming down into your stomach. And then the following tube is your small intestine where it says duodenum. That's the first part of the small intestine. After the surgery, all you have for your stomach is this tiny little pouch. They are removing the majority of your stomach. And now they are connecting your stomach to this kind of mid part of your duodenum. So again, it's bypassing a very important part of your small intestine where things are absorbed. So, nutrient deficiencies can happen, vitamin B12, iron, calcium, folate. There's something called dumping syndrome. Now you have such a small stomach that things are going to be moving through it so much faster. What the stomach does is there's that churning of the food to make it into a liquid. Things sit in the stomach for a bit to be really broken down. But now that you've had this surgery, things are really moving through very quickly. They're not being broken down by the hydrochloric acid and they get dumped into the small intestine. And this can cause nausea, vomiting, diarrhea, dizziness, and sweating after eating. Gallstones can happen because of rapid weight loss. You can get strictures, you can get ulcers, narrowing of the stomach outlet. You can get anemia because you are not being able to either, you're not getting the vitamin B12 away from the protein, and then you're not able to absorb it in that first part of the small intestine. And then, of course, surgical complications. So now let's look at the gastric sleeve or sleeve gastrectomy. This is when they are removing a part of the stomach, and it's about 75 to 80% of the stomach, and they're leaving this long, narrow tube. And they usually always say it's about the size of a banana. And this reduces the size of the stomach, and that's going to limit food intake. It also reduces the production of ghrelin, which is the hunger hormone. So you're just not going to have as much of an appetite. But unlike the gastric bypass, at least this still keeps the small intestine intact. So you have that full small intestine. You're not bypassing any portion of that. But the problems with the gastric sleeve, you still can have nutrient deficiencies. You still may not be breaking down the food as well when it's in the stomach, that vitamin B12, that iron, and then you might be getting some reflux because, again, it's now changing the pressure in the stomach, and you may have some of that reflux of contents into the esophagus. Reduced hydrochloric acid secretion, you are removing 75 to 80% of the stomach. So you are drastically decreasing the amount of cells that produce hydrochloric acid. And of course, then you're not going to be able to break down your protein as well. You have faster gastric emptying, meaning the food that's in the stomach is being put down into the small intestine so much faster than usual. And you can get strictures or a narrowing of the stomach, as well as just regular surgical complications. So, this has been the overview of the stomach. Now, when your stomach works correctly, it is a beautiful thing. There is so much that's going on in the stomach. And sometimes we just don't think about the stomach as much. We're always more concerned with the small intestine and the colon. But this is where a lot of the action takes place. This is where all the breaking down of the protein, this is where you are releasing the vitamin B12, the iron, things that you need on a daily basis so you can absorb the nutrients. So, this is just that overview. So, if you have any questions, you can certainly comment below. If you're having specific problems, you can certainly DM me. I have something that I call a root cause call. It's a free call with me. It's about 20 minutes where you fill out a form and you let me know what's truly going on with you. And then I basically get on the call after looking at the form. I'll ask you some questions to get a better idea of what's going on. And then I summarize your root causes, why you are having the issues right now, and then the things that you can do on your own. So this isn't a sales call. It's purely a clarity call so you can understand what's going on in your body better. So please feel free to reach out to me to schedule a root cause call. Just comment below or DM me. All right, I hope you've enjoyed this video number 4. I hope you understand the stomach, hydrochloric acid, these several surgeries a little bit more. All righty, talk to you later.